You're exhausted, gaining weight, and your hair is thinning. Your anxiety also is probably through the roof. And maybe people keep on telling you that it's just menopause. But what if it's actually your thyroid? I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative physician. Today we're going to be talking about one of the most confusing questions my patients ask me all the time. How do I know it's my thyroid, perimenopause, or menopause? And honestly, this gets overlooked so often because the symptoms overlap perfectly. So let's talk about some of the clues that tell us someone is dealing with a thyroid issue compared to just menopausal symptoms. With menopause, you're going to be experiencing hot flashes. You might start noticing that you're not sleeping as well. Maybe you start noticing a little bit of mood issues too. So these could all possibly be related symptoms to a thyroid. But one thing that I see with thyroid issues is typically you don't have hot flashes. So those are some things that I look for when I'm seeing patients of what can tell me, okay, we need to really dive into the thyroid and see if that's really related to what's going on. So some of the symptoms that greatly overlap is that fatigue can be related to both of them, and a little bit of brain fog could possibly be related to the two of them. So that's the one that makes it really hard, is like, okay, is there fatigue and brain fog related to the thyroid, which is more common symptom with thyroid compared to hormonal dysregulation with menopause. So a lot of women can feel confused or dismissed because they're feeling symptoms and they go to the doctor and they're like, hey, I think I have a thyroid issue, or I think I have some hormonal disturbances, and the doctor is like, okay, maybe, and they order some labs, and then they get the labs back and they're just like, oh, they look all normal. And a big reason for that is they're just not diving into it deep enough. They're not ordering like a detailed thyroid panel. They're usually just ordering a TSH, not looking at a TSH, free T3, free T4, reverse T3 to really see what's going on. Now, with like menopausal symptoms, okay, you go to the doctor and many times they order just an estrogen. Okay, and they're like, okay, your estrogen is looking maybe a little lower, it's looking at average, and they're like, you don't really need anything that's not related to that. They're just looking at I call it the sick norm on the labs. They look at the labs and they're like, oh yeah, you're normal for your age. That's a big thing that could be really confusing too, is the doctors aren't looking at the functional labs to actually give you the appropriate prescription to help you feel better. Yeah, when a woman comes into my office, they're dealing with some weight gain, let's say fatigue, brain fog, maybe some sleep issues. There's a lot of different labs that I'm going to be looking into. Depending on their age, let's say they're postmenopausal, I'm definitely going to be looking at their hormones. But a huge one too is I'm going to look at the thyroid and make sure the thyroid's working well. Another one I like to add into this is I like to look at their cortisol. Yeah, so if a woman came into me and they're questioning, okay, what's going on? Is it my thyroid or is it really related to menopause? You need to sit down and really identify all those and do detailed laboratory testing to find out the cause of what's going on so we can treat it appropriately. So what's the big difference going to a regular conventional medical doctor and a naturopathic medical doctor? The big difference between the two is the lens they look through, the approach that they're going after. One side, allopathic medicine, the conventional medical doctor is looking at, okay, we look at the disease, and if we eliminate the symptoms of the disease is cured. The naturopathic medical doctor looks at it in a different way. It's not looking at, okay, it identifies the disease, but it's looking at what is the cause of the disease, and through eliminating those causes, the disease is cured. So a lot of times the allopathic physician, the medical doctor, is looking at, okay, what can we do symptomatically to treat what's going on? So I think you're getting a good idea that the differences between the conventional doc and the naturopathic medical doctor is really, one is symptomatically treating, not looking for underlying causes, and the naturopathic doctor is doing that. If this video helps you understand what is actually going on in your body, make sure to subscribe because we're constantly talking about hormones, thyroid health, metabolism, and natural ways to support long-term health. Use the description below to book your call with me.